Hello, and thank you for joining me. My name is Dr. Alan Bass. I'm the Medical Director for NEMO Health, and I wanted to let you know that when it comes to TRAKnet and MIPS in 2018, you are all set to go. What you do need to know is TRAKnet is a 2014 certified software, and Medicare has stated that all software that is 2014 certified is applicable for submission of MIPS data in 2018. You should know that most electronic health record companies are utilizing software that is 2014 certified. Only a very few companies are certifying their software to the most up-to-date 2015 version. Please do not contact our support team regarding this matter. TRAKnet is up to date, is ready to go in 2017, and is ready to go in 2018. If you've been collecting your MIPS data in 2017, starting January 1st, you're all set to go. Continue collecting your MIPS data in the exact same way. What's also important to know is that NEMO Health has invested a lot of money and is finishing up the 2015 certification for TRAKnet. This will make TRAKnet the most up-to-date certified software it can be, and this version is scheduled to be released on April 1st, 2018. This will make TRAKnet one of the few electronic health record programs that is certified to the 2015 version. This new certified software is going to have some new features in it that our users have been asking for. But before we get to that, let's take a quick review why we're here. What is important to know about MIPS and 2017 as it pertains to the advancing care information portion of MIPS is that you must meet all of the base measures under the advancing care information to receive any points. If you have any zeros in the measures, you will receive no credit for the advancing care and lose out on all 25 MIPS composite points possible under advancing care. If you do your security risk analysis, that's good. You need to do that. You will get no credit for it, but it must be done. You must e-prescribe. Although the right-hand column on your MIPS report will say no and a 0%, the reason it says that is that you receive no credit for this. You just need to do it. If you do at least one electronic prescription in 2017, and you could see that with your numerators and your denominators, you're all set to go. Just doing one prescription satisfies what you need to do for your base measure. In regards to patient access, you must send at least one CCDA to a patient. If you send at least one out, you're all set to go. In regards to health information exchange, you must refer out at least one patient and document that you have done so in TRAKnet. If you send out the one patient in TRAKnet, you're all set to go. By doing these 4 things under your base measure, you will receive 12.5 out of a possible 25 points under the advancing care. Doing the remaining measures will earn you some additional points. In regards to your quality measures, a measure must have at least 20 patients in the measure for it to be used. You should also try to get a high performance rate for your measures, as well as a minimum data completeness of at least 50% in order for you to utilize that measure. Remember that your hemoglobin A1C is known as an inverse measure, and you should actually have a low performance rate, indicating that your patients are well controlled. For your clinical practice improvement, you're going to be getting an update to TRAKnet early in 2018 during the first quarter in order for you to have a new screen that's going to be able to have you indicate which clinical practice improvement activity you did in 2017, so when you report it in 2018. Some other important information: if you're collecting your data and submitting it via registry, you actually have until March 31st of 2018 to make sure you have all your numbers buttoned up, have all your data collected prior to that deadline. That is the deadline for submission of your data to the registry. If you're submitting the data to registry, you must also submit your specialized registry data. But that needs to be done prior to the end of this year, prior to December 31st of 2017. And your specialty registry data can be found under your reports tab, and you see the steps right here. You only need to submit this if you're submitting your data for the rest of your information via registry. If you're collecting your data via claims, you must have all of your numbers buttoned up prior to December 31st of this year, of 2017. And if you collected and submitted your quality measures via claims, you're going to need to attest to your advancing care information and your clinical practice improvement through Medicare, through CMS, through their attestation page, which is not yet up and running, but will be after the beginning of the new year. There have been a few changes to the MIPS program which did not require the new certified software, and TRAKnet is going to be releasing those changes prior to January 1st of 2018. Collection of the data under the quality measures portion of the MIPS program is now for 1 calendar year. It goes from a 90-day reporting period to a full calendar year. And your data completeness rate for your quality measures is going to increase from 50% to 60%. So remember, your quality measures goes from 90 days to a full calendar year, and your data completeness goes from 50% to at least 60%. The collection of your data under the advancing care information and under the clinical practice improvement activities will remain at 90 days. There are some other changes that are coming to the MIPS program, but this is something that we're going to cover early in 2018. If you still want to just remain neutral and do nothing as it pertains to MIPS, I do not want you to receive a penalty. In order for you to protect your 2019 Medicare Part B fee schedule, you need to submit a single claim to Medicare on a Medicare Part B patient. And although one claim should be sufficient and take care of it, I recommend submitting it on about 6 claims. You're going to accomplish this by finding Medicare patients who are non-tobacco users. You also need to submit a claim for that Medicare patient that has an E&M code, a 99 series code. You can have other procedure codes on it, but at a minimum must have a 99 series code. You can't just have a procedure code for this claim. So you will bill the E&M code and attach the diagnoses. You can have additional procedures, but you must have at least the E&M code again. Additionally, on the invoice screen, you're going to type the code 1036F for a non-tobacco user and hit enter. This will now show up on your invoice screen. You'll add the same diagnoses to that code as you did to the E&M code. Make sure that that 1036F code has a penny charge for it to go through, and you're going to now submit that claim. Once you've submitted the claim, keep track of those 6 patients. Review the EOB when it comes back from Medicare. You should see a remark code known as N620, which is an alert which lets you know that this was acknowledged by Medicare and that the procedure is for reporting and quality reporting informational purposes only. Print out the EOBs and file them away. This is your proof that you have done what you needed to do in a timely fashion in 2017, and you should not be receiving any penalty in 2019. So in 2019, if you've done these steps to protect yourself, check your EOBs early on to make certain that you haven't received any penalty. So what's coming in the first quarter of 2018? Some new things that we needed to do. ICD-10 codes are going to be printing on any prescription that you need to print out. There are some states that now require the diagnosis codes to be on printed prescriptions. During the first quarter, you're also going to have the ability to send electronic secondary claims as opposed to dropping them to paper and sending them out. You're going to see some new features under the My Practice report card and the code audit compliance features within TRAKnet. Some new features are going in there. And you're also going to see some updates to the current screens for the submission of your MIPS data prior to the deadline of March 31st of 2018. So before you need to submit your data to the registry, you're going to see some new screens with an update from TRAKnet in order to submit that information. And in the second quarter, April 1st, we're anticipating releasing our new certified software, which is going to have our new patient portal. It's also going to have some new and improved MIPS screens. It will not change your data and the percentages of what you've done during the first quarter. You're also going to see some new functionality as it pertains to e-prescribing. Are you worried about MIPS? Please don't be worried. Because if you decide to outsource your billing to NEMO billing, you will have a built-in consultant who is going to monitor your MIPS data throughout 2018. That's just one of a whole host of benefits that you will receive if you decide to outsource your billing to NEMO billing. We have many clients who outsource their billing to us, and when it comes to MIPS, they had their hand held during 2017, and they had no worries whatsoever. If you have any questions, please, as a reminder, do not contact our support team with questions as it pertains to MIPS. Please email all questions to myself at the email address that you see on the screen. You will receive the answer to your question within 24 hours. Again, our support team is not there to answer questions about MIPS. Please send those questions to myself. I want to thank you very much for listening to this video and look forward to helping you navigate through MIPS in 2018. Thank you.